Welcome to Rare on Air, the monthly podcast from EURORDIS, Rare Diseases Europe. I am your host, Julien Poulain, and once a month, we will be exploring the challenges, experiences, and successes of people who live with the rare condition. In this episode of Rare on Air, we are privileged to be joined by two presidents of two different organisations from the membership of EURORDIS. Each of these organisations champion and support communities affected by quite different rare conditions and in two different corners of Europe. Our initial guest is José and Claas, the president of the Dravet Foundation in Spain. José candidly shares his family's experience of grappling with his son's diagnosis of Dravet syndrome, a rare and particularly severe type of epilepsy. We then have the pleasure of speaking with Claas, president of NF Kinder in Austria. While the experiences of those living with Dravet syndrome in Spain and the experiences of those living with neurofibromatosis in Austria may be distinct, our conversation with José and Claas unveils some of the common mental health challenges that pervade the lives of families grappling with rare diseases, while also shining a light on the invaluable and impressive role that rare disease communities themselves can play in actively addressing their specific well-being needs. José and Claas, thank you very much for joining me today.
Thank you very much, Julien, for your invitation.
Julien, thank you for having us.
Thank you. So today, of course, we're talking about support for people living with a rare disease. And when it comes to support for people living with a rare disease, the focus is generally on how to directly medically address the rare condition or its symptoms. But living with a rare condition poses many direct psychological well-being challenges to the person with the condition and their family. And the mental health needs of the community are all too easily overlooked. Health systems don't usually provide the bespoke psychological support that is needed. And so, of course, today we're talking to two different presidents of different rare disease organizations representing particular rare disease communities in different areas of Europe. José, I would like to start the conversation with you and ask you, how did you first learn about your son's Dravet syndrome?
Yeah, so the first symptom in Dravet syndrome is a seizure. And that was our case. I live in France, despite I'm from Spain, and I live in the Dravet Syndrome Foundation in Spain. I live in France, and I remember practically the date. It was 14th of July, the national day here in France. I was playing with my son. He was at that time 6 months of age. And suddenly his body started shaking. His leg and arm started shaking. And both myself, I and my wife, we didn't know at all what's wrong. It was the first time in my life that I saw a person having a seizure, so we called the emergency services. My son got hospitalized. Many tests were done during that hospitalization, but no diagnosis at all. After a couple of more episodes, his child neurologist ordered a genetic test, which resulted in a positive de novo SCN1A mutation, which is the gene causing Dravet syndrome. That's how we met Dravet syndrome. I mean, I can say we got somehow a fairly quick diagnosis, but that's unfortunately, this is not the case for patients and families. And then, coincidence or not, some years later, we met Charlotte Dravet, who was the person who first described Dravet syndrome. And as I was saying, coincidence or not, she was also born on 14th of July, the same day Dravet syndrome started for us.
So over the years, what have been the regular sort of health challenges, the physical health challenges directly relating to Dravet syndrome? And how have the mental health challenges compared to those direct challenges of the epilepsy and of the Dravet syndrome?
Yeah, so living with Dravet syndrome can be very challenging for both the patient and the family. And we have to cope not only with physical and social impact of the condition, but also the emotional parts. So definitely one of the biggest challenges we have to face is the mental health of ourselves. No? Epilepsy brings you uncertainty, much uncertainty. In Dravet syndrome, there is around a 15% of mortality rate, and half of that mortality rate because of SUDEP, sudden unexpected death in epilepsy. So it might be that your child is sleeping and the morning after your child is gone. So that has a massive impact on families. That's the reason why mental health is a challenge for families with Dravet syndrome, and professional support is required to cope with that, right?
It sounds like the mental health challenges of having someone in your family who has Dravet syndrome, it sounds like they're quite all-encompassing. The uncertainty, the anxiety, the amount of work that your family must do on a daily basis to make sure that your child is safe and healthy. So I'm aware, of course, and you've mentioned that your organization is running an initiative to support the psychological well-being of families like your own affected by Dravet syndrome. What exactly is your organization doing to address the bespoke needs of your community in this area?
Yeah, so indeed, we were trying to see what we can do to improve patients and families' quality of life, and we have a number of programs ongoing for that. So just to mention some, one of them is we call it Project Little Wish. That's a collaboration we have with the Little Wish Foundation. It's Fundación Pequeño Deseo in Spanish, whose goal is to make the dreams and wishes of the children with Dravet syndrome come true. So, in order to support them emotionally, not the children, but also, the parents, because you can temporarily somehow distract them from the disease while seeing your child with Dravet syndrome is the dream of your child with Dravet syndrome is coming true. So yeah, that's one of the programs. We also have a program which we call the Solidarity Fund, which is aimed at supporting families on products and services not covered by the national healthcare system, including as well psychologist support and other type of support, which are quite important for our mental health and well-being. We are also running a program of attention and psychosocial support to families with Dravet syndrome. This is run by 2 neuropsychologists, and they are offering individual and family counseling as well as some group workshops to help families cope with the emotional and social challenges of living with Dravet syndrome. And then we have 2 kind of respite programs. On one side, we have what we call our Family Respite Weeker program, where we offer short-term stays in which the foundation provides a service to caregivers for the children with Dravet syndrome and their siblings, where on one side we organize leisure activities for the parents, and we have a number of professionals taking care of the children while they are outside enjoying. And a newly initiated program, we call it Project Take Care, where we are offering an external professional caregiver for them to have the opportunity to take a break and do activities like, I don't know, you like and relax, going to the cinema, having dinner and so on. And all those programs are for free to families. We want to make sure they all have equal access to this program so they can somehow get their mental health and well-being improve thanks to this program. The impact, of these activities is somehow hard to measure, but yeah, they have certainly improved the quality of life and well-being of many families who are facing the daily challenge of Dravet syndrome.
What is the value of an organization like your own, which understands the condition, delivering this type of support? How important is it for people to be supported by an organization like yours that understands Dravet syndrome?
Yeah, I think it's key to have the support from people who are facing the same challenges as you. Rare disease and even epilepsy, it's a very heterogeneous field, and therefore I think the value we are providing here is knowing exactly the challenges faced by those patients and families with Dravet syndrome. In the head of the foundation, I have a child with Dravet syndrome, and in our board of directors, we have 5 members, and all of us has a child with Dravet syndrome. So at different stages, one of the board members, I think, her child is 3 years old, and we have one which is the oldest, which is 20-ish. So different ages and different challenges over the course of their life, which makes our experience key to support families, patients and families with Dravet syndrome.
So, Claas, I'm aware that your organization runs quite similar initiatives. But first of all, how did you first learn about your daughter's NF1?
Well, the first clinical signs of NF1 appeared when my daughter was about 3 months old. And the first signs are so-called café au lait spots, which are light brown pigmented patches on the skin. And about 95% of children with NF1 develop these spots in the first month of their life. But we were really at first thinking, well, it's just, pigmented spots. I didn't think it would be something serious. I thought, well, just some patches will be fine. But then you start to be, you get concerned because more and more of these patches appear. And of course, you start Googling and try to find out what's going on. And then we quite soon found out that this can be an early sign of neurofibromatosis type 1. And when we looked at the pictures online that were shown connected to this disease, we were quite shocked, because you see worst case scenarios of people who are covered in large tumors, disfigured tumors, and it looked just, like a very terrible disease. Our pediatrician at the time was not very familiar with the disease, so he started Googling when we asked him about NF1. So we then really had to see different doctors, and we got very mixed reactions. We had doctors that said, well, don't worry, it will be fine. I'm sure it's nothing, but they didn't do any testing. And other doctors said, well, for sure, that's NF1. And we were really like in this ice cold type of situation. And finally, after about 3 months of consulting different doctors, we arrived at a neuro-oncological department at the university clinic in Vienna. But for the first time, we really felt understood, and that the people knew about the disease. And then with further testing, genetic testing, we had, the sad confirmation that our daughter indeed has NF1. And that's when, on one hand side, all our hopes that it will be maybe nothing, they vanished. But on the other hand side, it was like, okay, now we know for sure that this is what our daughter has. And we can, learn about this disease. We know what to look out for. We plan regular checkups with the doctors there that know about this disease. So, on one hand side, was sad because it was the sad news. But on the other hand side, we were able to recalibrate and look forward and take it on from there. Yeah, and then my daughter, unfortunately, like about 20% of children with NF1, they develop tumors on the optic pathway. And my daughter did so at the age of 2. And she had to undergo chemotherapy for 18 months and also had a brain surgery because of another tumor. So brain tumors are unfortunately very common in children with NF1. And if the tumor damages the optic nerve, you can have sight impairments or even go blind. So that was the big fear that we had, that our daughter could lose her sight. But fortunately, the chemo worked well for her. She doesn't have any impairments of her sight. She's now 14 years old, able to do sports. So she doesn't have any major impairments. So she's living a relatively normal life at this point. But unfortunately, in many rare diseases, also with NF1, they can behave very unpredictable. And throughout life, there's new challenges that might come up. So her life will look like she will have regular checkups. She will, always be in this cycle of checkups and planning visits and going to the doctor, discussing the results of the examinations, hoping that nothing will come up. But that's I think something also that is very common or similar throughout most rare diseases, that this unpredictability also adds to the psychological pressure that the whole family feels at the start, that the parents, when the children are very young, like also José told us, his son was just 6 months old. So at the start, the parents need psychological support, because suddenly you're dealing with this new situation and you feel like the whole world comes crashing down on you and you don't know what to do, basically. And you have to become an expert for this disease in order to take good care of your child. So at first, it's the parents that need psychological support. But of course, the older the children get, the more support they need as well.
I will be continuing my conversation with José and Claas in just a moment, but I would just like to remind you that tickets are now available for ECRD 2024, the 12th European Conference on Rare Diseases and Orphan Products. The conference will be on the 15th and 16th of May 2024, and it is Europe's largest patient-led policy-shaping event in rare diseases. In fact, one of ECRD 2024's key 6 sessions will be on mental health and the co-creation of a mental wellbeing toolkit for the rare disease community. The conference is a must-attend for anyone looking to remain informed and engaged in pioneering solutions to improve the lives of people living with a rare condition. Get your tickets for ECRD 2024 today at rare-diseases.eu.
It's interesting. I think you both refer to what could be called a sort of cycle of uncertainty. Of course, one of the things that is often a strain on people who live with a rare condition is a long sort of diagnostic journey. But of course, even when a diagnosis is received, however soon or late, when the prognosis is uncertain, the mental health challenges can be exacerbated or sort of blossom into something totally different, but also equally strenuous to one's well-being. I've heard you previously talk also about how the psychological strains on people who have NF1 can change over the years. It's not just about uncertain prognoses, but also social stigma. Could you talk a little bit about that?
Yeah, of course. So in NF1, the most common symptom that basically almost all adults are facing, about 98% of adults with NF1 develop so-called cutaneous neurofibromas, which are benign tumors that are growing on the skin or just under the skin, and they are not, life-threatening. They will never turn cancerous. So they have been neglected by doctors for the longest time because they said, well, it's just a cosmetic issue. But yes, it is a cosmetic issue, and people are bothered by them because they can even have hundreds or even more than 1,000 of these benign tumors and are covered sometimes from head to toe. So their appearance changes rapidly. It usually starts around the age of puberty, and then it gets worse and worse over time. So imagine having a totally normal skin as a teenager, and then gradually you have more and more of these tumors, and then you look at yourself in a mirror 20 years later and you don't recognize the person that you once were. So this, of course, is a huge psychological pressure. You go out in public and you see people staring at you and people making nasty comments. It's difficult to find a job or a partner in life. So we see some of the adults who are affected severely by these tumors who are just, they don't leave their house anymore. They order their food. They communicate online, but they don't want to expose themselves to these type of situations. So we were involved in a survey with over 600 NF patients in the US. And it turned out that 80% of the participants of this study said that they either have a diagnosed mental health issue or a suspected mental health issue. And most of the time it's depression or anxiety issues. And also the suicidal ideation rate is much more elevated in our patient group compared to the healthy population. So it really is just such a strong sign that not only health, physical health issues like tumors can threaten the life of the patients, also mental health issues like depression can be fatal and need to be addressed as importantly as physical health issues. And I think that's where patient organizations like ours come into place, because we as parents, we just know this from our everyday experience and we want to provide support. Yeah, that's also what we did, very similar to José. We just identified those gaps in mental health support or mental well-being support. And we really started to develop programs that provide this type of support. So really for parents who just received the news, sorry, your child is affected by NF1. We do have a free of charge virtual support program where the parents can have regular appointments with a family counselor, and this counselor is really there to talk with the parents about their fears, their problems, but also helping them along the way. What are the next steps? So where are the true specialists that you can consult? Do you need psychological support as well? We have a social worker that's really helping the parents to get also social support from our social system here in Austria. And then, for parents with children in like kindergarten age or primary school age, we have like family weekends where they can spend a long weekend together with therapists to provide horse therapy and animal therapy. And that's for many parents the first time that they get to meet other parents who also have a child with NF1. So for them, it's really this first experience. We're not alone. There's others who are going through the exact same thing.
Jose, actually, I'm curious, have you also found that through your initiatives, families getting together is also valuable in that regard? Is that part of what also your initiatives provide, the opportunity for families to feel less alienated by coming together?
Every year, we organize on one side what we call regional gatherings, and then on the other side, every year we also organize our annual family meeting. Actually, our next family meeting will be March 16 in Madrid, and we get about 80 or 90 families with Dravet syndrome. For some of them, it's the first time they are meeting with other families with Dravet syndrome, with other people facing with the same challenges. As a class say, that's quite valuable for them to see that there are other people facing the same issues and they can learn each other.
Yeah. Do you remember, actually, out of curiosity, a question to each of you, Jose, and then I'll ask Claas. Do you remember the first time your family might have been introduced to another family with the condition you're affected by? What was that experience like?
So for me, actually, I think it was in the annual family meeting of our foundation in 2016. That was done in Burgos, 200 kilometers from Madrid. And it was a two-sided experience. On one side is, you could see, some other families or children who were older, some of the issues they were facing, like cognitive delay, motor issues, and so on. But on the other side, it was great to get in touch with other families and start sharing experiences and hopes.
That's interesting. And Claas, when was the first time that your family might have been introduced to or might have met another family affected by NF1? And what was that experience like?
I think the really first, good contact to another family was while our daughter was going through chemotherapy. We, at the same time, another family with a daughter, same age as my daughter, had the exact same type of tumor and also did chemotherapy. So we really felt, okay, we're not the only ones going through this. So, and then later on, when we started the organization, this family also participated in lots of the programs. And to this day, we are in contact. We receive Christmas cards from each other and enjoy to see how well they have developed since then, and that they are still enjoying their lives, still going through, a lot of struggles, but enjoying their lives. And I think like the focus, if you go online, also if you go to Facebook groups, usually people with rare conditions, they post about, the problems that they are facing, of course, but this can lead to a slightly distorted picture of the disease because you only see negative news. And in one Facebook group, I try to say, well, why don't we all start posting success stories? Because I'm sure every child also has successes. So let's start also talk about them so that we, just elevate our spirits together. Because I think that's important.
That's beautiful. So, Jose, what do you believe national governments should do to make sure that people living with a rare disease find their mental health and well-being improved?
So first thing I would say we need, especially in Spain, it's a renewed and new national plan for rare diseases, which will include as well mental health support and care. Then increasing definitely the availability and accessibility and overall the resources for psychosocial and psychological services for people with rare diseases and their families, as well as training and education for health and social care professionals on rare disease mental health. Then in parallel, I will say we need to promote the participation and empowerment of people with rare diseases and their families in decision-making processes and policy development, which is most of the time not the case. And as well, we need to enhance and to improve and boost research and innovation for rare disease mental health, as well as that's another topic, but the collection and sharing of data and evidence on prevalence, impact, and outcome of mental health issues among people with rare diseases.
Absolutely. No, sort of action right across the rare disease spectrum of policies that all contributes obviously to mental health. So you're right to mention those. And Claas, what do you believe national governments or perhaps the government in Austria, for example, could do to improve the mental health of people living with a rare disease?
Well, we know that about 5% of people throughout Europe are affected by a rare disease, and that only 94% of those have approved therapies available. So we have a very desperate group of lots of people. In Austria alone, it's about 450,000 people living with a rare disease. And unfortunately, to this day, the Austrian government doesn't provide any specific funds to tackle those, challenges, both medical and psychosocial challenges. So I would love to see the government step up and here in Austria and provide dedicated funds to address those needs. We have a rare disease plan, an action plan, but never backed up by money. So it's just words on a piece of paper, and that's not helping people. So we need to really invest money, support the already approved centers of expertise who are parts of the European Reference Network. They need to have a budget available to really perform the way they are expected to perform. But then also, like I said before, we need, in terms of mental well-being, we need access to psychological assessments, and then we need access and reimbursement of needed therapies. And in rare diseases, in chronic diseases or conditions, it's not a matter of, okay, you get 10 appointments with a psychologist and then you should be fine. No, it's usually really throughout life that you have maybe some phases where you need very intense care and support and you need weekly visits. And then maybe at some other points in your life, you need less frequent visits, but it needs to be continuous. It needs to be really individualized type of care. That if you need more intense support, then it should be available to you. And right now in Austria, we don't have reimbursed psychological treatments, for example. So this is a real lack. And like when you asked Jose before about what's the value of patient organizations like ours, and I would say we should be definitely involved in the planning and also design of psychological services, because
Absolutely.
we understand the needs of our communities. And when you develop a service, it needs to be addressing the needs, and it needs to be really covering what's important. If those services are designed by someone who doesn't have any knowledge about the disease, well, the chances are very high that it will not really be fitting. So I think generally in all healthcare services that are developed, you need to involve patients. Otherwise, you are not understanding the needs of the population.
Absolutely. So I guess you could say that it's not just about a lack of provision that needs to be made up for by governments and their health systems. It's also about the provision itself needs to not maybe further the alienation that families like yours feel by the needs not being addressed, or the nature of the therapy not taking into account the full breadth of experience of living with a particular rare condition, which, like you say, comes with so many very particular but very heavy challenges. Claas and Jose, thank you so much for joining me. It's been a really great discussion, and it's been really great learning about both of your organizations' really important initiatives. Thank you very much.
Thank you. Thank you very much, Julien, and thank you to EURORDIS for organizing this podcast.
Thank you.
Yeah. Thank you, Julien, and thank you to EURORDIS for, putting mental well-being on the agenda.
No, thank you.
Thank you for listening to Rare on Air. And remember, join us in May at ECRD 2024, the 12th European Conference on Rare Diseases and Orphan Products, taking place online and in Brussels. Visit rare-diseases.eu to get involved. But before then, thank you for listening to Rare on Air, and we look forward to you listening to our next episode.